Have you ever heard the phrase, don't step on a crack or you'll break your mother's back? Well, somebody better had been stepping on a crack this year because I definitely broke two vertebrae in my spine. We had a rough year at a family. My son also broke a bone in his body, and we have a lot of firsthand knowledge about this. So today we're going to be talking about the exemplar of fractures or broken bones. Go ahead and turn to Davis chapter 54, grab your exemplar worksheet, and let's study this chapter together. And hopefully I won't have too much PTSD by doing so. So did you know that 60 to 77% of unintentional injuries reported in the US are actually caused by musculoskeletal trauma? And this could be anything from soft tissue injury to bones that are broken. So the most common are sprains and strains, and fractures is the third most common musculoskeletal trauma that we'll see in the US. So how prevalent is this? Well, there's about 6 million fractures reported in the US annually. What is a fracture? Well, it's some kind of break in the bone, and there's a number of different kinds of fractures that can occur. So here are some of the descriptions of types of fractures that you can see. A complete fracture shows a complete break in the bone where the two parts are completely separated. An incomplete has a partial break in the bone, but the bone itself has not been separated. A closed or simple non-displaced fracture shows that there is a complete break, but the pieces still match up like a puzzle. And then a closed, simple displaced fracture is when those pieces no longer match up like a puzzle, and they're going to need some kind of intervention to bring them back together. Now, an open fracture, also known as a compound fracture, is when the sharp end of that fractured bone actually punctures through the skin. And so you'll see an open wound with the fractured bone. An avulsion happens when a small piece of bone is actually pulled away, broken away from the rest of the bone due to an overstretched or injured tendon or ligament. A comminuted fracture happens when the bone is just fractured and shattered into multiple pieces. A compression fracture usually happens in the spine, and it happens when forces compress that bone so much that it causes it to break. And that happens oftentimes, we see that with patients who are falling from a significant height. Now, a depressed skull fracture happens due to blunt force trauma, where part of the skull is actually broken and sinks into the skull. A green stick fracture is something that we're going to see in pediatrics. If you've ever tried to snap a fresh branch off of a tree, it's a green stick, and so it doesn't snap easily. It just kind of bends. And if you have an old, dried out piece of wood, it's going to snap a lot easier. And so children can get these green stick fractures where it's not a complete fracture, and it's because their bones aren't old and brittle anymore, and they can kind of bend and not face the same amount of trauma that an older bone would. Green stick fracture. An oblique fracture tends to have like a 45-degree angle to it, like an oblong shape. A spiral fracture wraps around the bone and causes fractures kind of down in a spiral. And an impacted fracture happens when those two parts of the on either side of the fracture actually are wedged into each other after the injury. So at the end of the day, a fracture is a broken piece of bone, but they can manifest or display in a number of different ways that we would see on x-rays. And depending on the type of fracture and where it is, we're going to have different types of interventions that are appropriate. So for patients who come in with suspected fracture injuries, we're going to want to get a full history, and especially cueing into things like, are they on any blood thinners that might put them at higher risk for complications? Do they have a history of osteoporosis or brittle bones that could make them more likely to have fractures? And then what kind of physical assessment are we seeing? Do we notice any displacement, any deformity, any swelling? Are they guarding an area, not able to move it? Are they able to bear weight if it's on their feet or legs? Are they able to walk on it or not? These are the types of things we're going to look at. We're also going to talk about the mechanism of injury. So did this happen tripping down the stairs? Did this happen in a car accident at 80 miles an hour on the expressway? Because the amount of trauma, the amount of force can indicate kind of how much trouble we're really in. Now, most fractures are going to be able to be viewed on a simple x-ray, X-rays are cheap, they're accessible, and they give us a nice image. But some fractures are only going to be noticed on a CAT scan. Now, treatment and management of these fractures is really going to depend on the type of injury, the kind of fracture, where it's located, and how it's going to best heal. So there's non-surgical and surgical options. So non-surgical is a closed reduction. So that's if those two edges of the bone after the fracture don't line up. If they're displaced, the physician needs to get those back in line so that when those two bone parts grow back together, they will heal as a nice straight line. And so a closed reduction, they actually yank on the arm, leg, appendage, whatever it is, and actually pull until that clicks back kind of in place so that it'll heal that way. And then the leg is casted that way. My oldest child, Reagan, fell at the pool a few years ago, had a buckle fracture in their wrist, and had to have a closed reduction. So they put Reagan under moderate sedation, so they were really sleepy, and then pulled on Reagan's arm until that bone, that displaced bone, popped back into place, then casted it so it could heal appropriately. Now, open reduction has to happen with surgery. Sometimes it's not good enough to just pull on it and try to get things realigned. So when my son broke his arm at parkour class, he actually needed pins put in to realign the bones of his humerus so that they would grow appropriately. And there's two different kinds of fixation. This is the pins. They can do internal fixation, where pins are put inside the bone and you don't see them on the outside. Or like my son had, you can have external fixation, where those bones are the pins are put in, but the outside of the pins actually are on the outside of the body. And then those pins are pulled out and removed 4 or 6 weeks later. So closed reduction, everything happens just with moderate sedation and just some yanking. It looks a little aggressive, but it works. Surgical option is for an open reduction, which could involve some kind of fixation, some kind of pins, either internal or external. Now, when bone pieces aren't aligned, it can actually cause muscle spasms in that area, and it can be very painful for the patients. So in addition to these external fixators, there's traction that's a way can be combined with any of the other treatments. And traction helps to involve the use of weights and force to reduce the fracture and relieve compression. And so you can see a couple different examples of traction here. One is skeletal traction, where the pins are actually into the bones, and then the weight pulley system is on the outside, or skin traction, where it's just using like some kind of boot or something on the outside to help pull and relieve some of that pressure so that we don't have muscle spasms and that bone can be nicely reduced back to where it needs to be. Here's an example on the tibia and the fibula of an external fixator. And this one not only has pins, but has some kind of outside mechanism to really hold those pins perfectly in place. So this is an example of external fixators and traction.